All right, so we're diving deep into AI and healthcare, specifically how it could impact GP practices here in the UK. It's a hot topic, and, we're not just speculating. We're going right to the source. A conversation among GP partners and managing partners, the people actually running these practices, about how AI could actually work for them. Oh, and by the way, for all the GPs out there listening on the go, don't forget about GP Chat UK. It's the best way to stay updated.
It's fascinating, right? These GPs aren't just thinking about the future, they're feeling the pressure now. Rising minimum wage, national insurance contributions, all squeezing their budgets. So they're really searching for solutions. And this conversation, well, it shows how AI might be the answer.
So it's not really a question of if anymore, it's how.
Exactly. The big question they're wrestling with is, can AI help practices survive? And not just survive, but thrive, while still giving patients the best possible care.
It's a balancing act for sure. So let's break it down. What benefits are they actually talking about?
Well, imagine this. AI handling all those tedious admin tasks, scheduling appointments, managing records, even processing prescriptions, all done automatically. One study even suggested that just AI appointment scheduling alone could reduce staffing needs by 15%. That frees up so much time and money for patient care.
Wow, 15%, that's huge.
Yeah.
But what about the clinical side of things? Can AI really make a difference there?
Oh, absolutely. Think about AI diagnostic tools, analyzing medical images, flagging potential issues, even suggesting diagnoses. It's already happening in radiology. AI can spot abnormalities in scans with incredible accuracy. So this kind of clinical decision support, it can help GPs make faster, more informed decisions, ultimately improving patient outcomes.
That sounds incredible. But I can see the other side of it too. Could this make GPs rely too much on AI?
Yeah.
Maybe lose some of their own diagnostic skills. Some people even say AI in healthcare is overhyped.
It's a valid concern, and it's crucial to remember. AI should be a tool to help GPs not replace them, like a second pair of eyes, offering insights, highlighting things that might be missed. And the evidence is growing, especially in image analysis and risk prediction. Studies show AI can actually outperform human experts, at least in some diagnostic tasks, especially when you're dealing with huge amounts of data.
So it's about enhancing human expertise,
Yeah,
not replacing it.
exactly. Now, another area where AI could be a game changer is preventative care. Imagine AI chatbots interacting with patients, giving personalized health advice, even reminding them about medication or checkups.
Like a personal health assistant in your pocket. Sounds great for keeping patients engaged, but there's a big question that comes to mind. What about the human workforce? If AI takes over so many tasks, what happens to the people?
You're right. We can't ignore the potential impact on jobs. It's a big concern for a lot of GPs. It's a really sensitive issue, and one that needs to be addressed carefully. The GPs in this discussion, they're very aware of the potential for job losses. They're worried about the impact on their staff, people who have been dedicated to their practices for years.
It's not just about numbers, it's about people's lives.
Yeah.
And the whole atmosphere of the practice. Losing experienced staff, that could really hurt morale.
And you can't just replace that experience overnight. It takes time to build up that kind of knowledge and understanding of how a practice works.
So how do we manage this? I mean, it's a tricky situation, wanting the efficiency of AI, but also protecting the people who make these practices run.
Well, one idea that came up in the discussion was this concept of job evolution, not just job loss. They talked about investing in reskilling programs, helping staff transition into new roles that actually work alongside AI. So, for example, instead of replacing receptionists entirely with AI scheduling, you could train those staff members to manage the AI, ensure it runs smoothly, and handle any complex issues that pop up.
So turning a potential threat into an opportunity.
Exactly. AI isn't just about automating things. It's about changing how we work. And that means giving staff the skills and support to adapt.
I like that. But even if we manage the workforce side of things, there's still the question of patient trust. How comfortable are people going to be? With an AI system handling their medical information, it's a big step for some people.
Yeah.
To put their health in the hands of a machine.
You're right. Trust is everything in healthcare. And AI definitely adds a whole new layer of complexity. The GPs we heard from are very aware of this. They really believe that transparency and open communication are key. No secrets, no surprises. Patients need to understand how AI is being used, what data is collected, and how their privacy is protected.
So it's about building confidence and understanding, not just throwing technology at the problem.
Exactly. And that leads into another big concern, data privacy and security. These powerful AI systems, they need tons of data to be trained properly. So how do we balance that with GDPR and patient confidentiality? It's a real challenge. It needs careful thought and strong safeguards.
Balancing innovation and responsibility. It's something we keep coming back to.
It really is, and it brings up another ethical dimension that the GPs talked about, ensuring equity and access. We have to ask, could relying too much on AI actually disadvantage some patients?
You mean like elderly patients
Yeah.
who might not be as comfortable with technology, or people from lower income backgrounds who might not have the same access?
Exactly. We can't forget about the potential for digital exclusion. We need to make sure the benefits of AI are available to everyone.
So it's not just about implementing AI, it's about implementing it fairly and ethically.
Exactly. And the GPs had some practical suggestions for doing that. They suggested a phased approach. Start with less critical tasks. Build confidence and minimize disruption. It's about testing the waters before jumping all in.
A measured approach that makes sense. Anything else?
Yeah, they also felt that ethical oversight is crucial. They proposed setting up ethics committees within practices to keep an eye on how AI is being used and make sure it aligns with the practice's values and goals.
Like a built-in system of checks and balances.
Precisely. It's about having a framework for decisions and addressing any concerns that come up, making sure human values stay at the center of healthcare, even as technology plays a bigger and bigger role.
So it's clear that AI has this massive potential to really transform GP practices. But it's not just a simple plug-and-play solution.
Definitely not. It needs careful thought, open communication, and a real commitment to ethical implementation.
It's about finding that right balance
Hmm.
between embracing the new and protecting what matters most. Patient care, staff well-being, the integrity of the profession.
I think you've summed it up perfectly.
So we've covered a lot of ground here. We've looked at the potential benefits of AI in GP practices, the efficiency, the clinical interventions, support the possibilities for preventative care. But we've also talked about the potential downsides, job displacement, data privacy, the risk of widening inequalities.
It's a complex landscape.
For sure.
But the important thing is that we're having these conversations. We're facing the ethical challenges head on, and we're looking for ways to make AI work for good.
It feels like we're at a turning point in healthcare. And the decisions we make today are going to have a huge impact. So what can our listeners do to stay ahead of the curve?
Well, staying informed is key. This field is moving so fast. There's a lot of information out there. And resources like GP Chat UK are invaluable for keeping up to date.
That's right. GP Chat UK is the place to go for everything GP related, especially for those of you on the go.
Exactly. But it's not just about absorbing information. It's about actively engaging with it. Ask questions. Talk to your colleagues, attend webinars, and participate in online forums. The more we discuss these issues, the better prepared we'll be to make informed decisions.
Yeah, it really is a lot to consider, isn't it? It's not just about the tech itself. It's about all these ethical considerations and the impact it could have on, both staff and patients.
Yeah, absolutely. And it's not some far-off thing either. This is happening now. The decisions being made right now are going to shape the future of GP practices.
So where do we go from here? What can our listeners do to kind of stay ahead of the curve on this?
I think staying informed is absolutely vital. This field is constantly evolving. There's so much information out there. And resources like GP Chat UK, they're invaluable for staying up to date and connecting with other GPs.
It's true, keeping up with the latest developments. It'll really help you understand the nuances of all of this. And of course, for all those GPs on the go, GP Chat UK is the best way to stay informed.
Couldn't agree more. But it's not just about passively taking in information. It's about actively engaging with it. Asking questions, talking to colleagues, attending webinars, participating in online forums. The more we all discuss these issues, the better prepared we'll be.
It's about being proactive,
Mhm.
right? Not just waiting to see what happens. The future of healthcare is being shaped right now, and we all have a part to play.
Well said, and at the end of the day, it's about making sure AI serves humanity, not the other way around.
I love that.
Yeah.
So to our listeners out there, keep exploring, keep questioning, and keep imagining those possibilities.
Yeah.
The future of AI in healthcare, it's in our hands.